Describe the sequence of event that occur in cardiac cycle. Cardiac cycle is defined as the sequence of coordinated event which takes place during the heartbeat. The sequence of events that occur in cardiac cycle are described in below. First is isometric contraction. It is the first phase of ventricular systole. It lasts for 0.05 seconds immediately after closing the AV valve due to atrial systole. The atrioventricular valves are closed due to increase in ventricular pressure. The semilunar valves are already closed. Now the ventricle contracts as a closed cavity in such a way that no change in volume of ventricle or in the length of muscular fiber. Only the tension is increased in ventricular musculature. Thus, the pressure increases sharply in ventricles. Significance of isometric contraction is when the ventricular pressure increases above the pressure of aorta and pulmonary artery. The semilunar valves are opened. Second phase is ejaculation period. Due to the opening of semilunar valves and contraction of ventricle, the blood is ejected out on both the ventricles, hence it is called ejection period. The duration of this period is 0.22 seconds. Ejection period is of two stages, rapid ejection period and slow ejection period. Next phase is the protodiastolic phase. It is the first stage of ventricular diastole, hence the name is protodiastole. Duration of this period is 0.04 seconds. Due to the ejection of blood, the pressure in the aorta and the pulmonary artery are increased and the pressure in the ventricles drops. When the interventricular pressure becomes less than that of aortic and pulmonary pressure, the semilunar valve is closed. The atrioventricular valves are already closed. The protodiastole indicates the end of systole and beginning of diastole. Then next phase is the isometric relaxation period. During this period, once again all the valves of the heart are closed. Now both the ventricles are relaxed as closed cavities with any change in muscle fiber. So the interventricular pressure during this period, the duration is 0.08 seconds. Significance of this period is when the ventricular pressure becomes less than that the pressure of aorta and pulmonary valves. The semilunar valves are open. Atrioventricular valves open. Significance of the phase is when the ventricular pressure becomes less than that of pressure in the atria. The atrioventricular valves are open. Then rapid filling. When AV valve and atrioventricular valve are open, there is a sudden rush of blood from atria to ventricle. This is called first rapid filling period. About 70% of filling takes place during this period. It takes for 0.11 second. Then slow filling phase. After the sudden rush of blood, the ventricle filling becomes slow. Now it is called slow filling. About 20% of filling occur in this phase. Duration of this course is 0.19 seconds. Then the next phase is atrial systole. After slow filling period, the atria contract a small amount of blood, about 10%, enter the ventricle from atria. This phase is also called last rapid filling phase, and the cycle is repeated.